Hello, my name is Dr. Deborah Miller, and I'm a social worker and health services researcher here at the Cleveland Clinic Mellon Center. The topic that we'll be discussing today is Social Security disability and what's important for you to know about that. I'll be discussing this issue with Dee, who has been through this process and has just a few remaining questions. Hi, Dee.
Hello.
Can you tell me who recommended that you talk to me about disability?
Yeah, Dr. Sullivan. I was having troubles at work, and I wasn't doing good, so she advised for me to talk to you about all the options that I had.
Okay. Well, as we reviewed at the last appointment, you have been working and paying FICA taxes for the last 5 years. And that makes you eligible for the program called Social Security Disability. Now, the next step in this process is determining if you have the kind of physical or cognitive disabilities that make you eligible for disability as well. Now, have you seen our physical therapist and occupational therapist to assess your functioning?
Yes, I have.
Okay. And did they give you any feedback on how you're doing?
Yes, yes.
Okay. I looked at the chart note, and it seemed as if they were supporting of your disability.
Correct. And occupational therapy recommended hand controls for me to drive.
Okay.
And physical therapy was recommended a cane to walk and help with the balance.
Okay. With this information, we should be able to support your applying for Social Security disability. That's not necessarily good news for someone like you who wants to work, but it is useful information for the time when you feel like you're not able to continue working, that we've got the documentation that we need. Now, to just recall, a person needs to have worked 5 out of the last 10 years to be eligible for the Social Security disability program. And then there's a separate determination process to assess whether or not you're disabled enough to qualify for the program. Your physician is not the person who makes that determination. It is the staff at Social Security Administration who do that. We also talked about the fact that you're without insurance right now, and that you'll be eligible for Medicare as part of the health insurance program once you've been on disability for 24 months. Do you have some other source of insurance temporarily while you're waiting for Medicare?
Medicaid.
Okay. Well, so you do have good coverage for insurance receiving care here at the clinic, and we know that we've got the documentation that you need when the time comes that you feel that you do need to apply for disability. And what we'll do is continue to have intermittent appointments so that we can assess how you're doing at work and to determine when it might be time to make that application process.
Okay, sounds great.
Okay, thank you. Thank you for joining us today. I hope that this information was useful to you. If you have other questions that you would like answered, please visit our website, which is listed below.